Good morning, everyone. I know we still have people joining us, but for the sake of time, we're going to go ahead and get started. Welcome to Facilitating Community Engagement to Ownership. This is the first training in the FY25 IPLAN training webinar series, and this series is made possible with funding from the Illinois Department of Public Health and the Community Health Assessment and Planning Grant. My name is Laurie Call. I'm the director of the Center for Community Capacity Development at the Illinois Public Health Institute, and I'm joined by my colleagues Samantha and Kaden, and we have a peer presenter today, Amanda Mel. Amanda couldn't be with us in person, but she has provided an incredible video that we'll be sharing, so stay tuned for that. And we're going to kick things off with a quick Zoom poll introductions to see how community shows up in your IPLAN. So Samantha, you all should see a poll on your screen now. Looks like this. And you can just type your answer in, and then we'll be sharing some of those responses. If you're just joining us, we're answering the poll on your screen. It's an open-ended poll. You can just type your response in there. How are we doing on that, Samantha?
Only about 21% of us.
How about if we share these responses in just a few minutes? We'll let folks keep typing in. Can we do that? And I just move ahead?
Yeah.
Yeah, I'll do that. Okay. You can keep typing your response in, and then I can just continue through the overview of today's training. After the welcome and introductions, we're going to just provide some grounding with the spectrum of community engagement and a few key concepts and frameworks to set the stage for today. We're going to share some tools and resources for being able to move along the spectrum. We're going to have a break since this is a 2-hour session. We'll have a short break. So if you've got a phone call or need to check emails, you'll have a second to do that. We're going to talk about sustainable engagement through all the stages of IPLAN assessment, planning, and implementation. And Amanda's video will really talk about planning and implementation. And then we've got a second set of breakout groups where we're going to really work on applying the spectrum of community engagement. And then we'll wrap things up and share some resources with you. Our objectives today are to describe the role and importance of community engagement in identifying community health problems and setting priorities, as well as creating that action plan for IPLAN. We'll define the spectrum of community engagement to ownership and how you can move along that. And hopefully by the end of today, you'll also be better prepared to apply methods of community engagement throughout the cycle of assessment through implementation. And for group agreements, just to create a space where we can work together in breakouts. And throughout the training, we ask that you actively participate in the training. I know there's a lot going on, but if you can direct your attention to our discussion, it will be more lucrative for all the participants. In breakout groups, we have limited time, so be sure to step up and take some space, but also make space for others to share, and really try to understand different perspectives and experiences. We all work in different types of communities and may have some unique experiences that may be harder for others to understand. We'll try to move things along just to stay on time, and feel free to anytime ask questions in the chat or raise a hand. And if we can't get to it right away, we'll be sure to put that in the parking lot, and we can also follow up with responses to questions if we don't have time to answer those in the training. If there's anything else you feel like you need to ensure that we have a good learning space, please put that in the chat and we'll add it to our group agreements. Okay, I'm going to turn things to Samantha. She's going to give a quick overview of what IPLAN is requiring for community engagement, and also what are our public health accreditation requirements if you are going down that path. So Samantha?
Thank you, Lori. I did want to quickly share some of the poll results that
Oh,
we heard.
yeah, absolutely. Thank you.
So we got some really good insight here. So we asked the question, how does community show up in your IPLAN process? Someone noted we're working on a list for community members to invite to the meeting and a long list of community partners. Some folks noted assessing, so survey and focus groups, interviews, and reviewing and ranking the priorities. A few folks noted strategic prioritization, and that's how they're including community in their IPLAN process. Regular participation in action plan, teams and committees. We've got a couple folks noting that they, again, help identify the top 3 concerns for their community. Partnering with them to provide education and services in priorities of need. We got some really good information here. Some folks are new, so they're like, I haven't been involved yet, which is great to have you a part of this meeting today. And finally, some folks in helping to understand how we are moving forward with our objectives and strategy development. That is awesome.
Fantastic. Thanks everyone for that great input.
Yeah. Great, so moving right into the IPLAN and FAB requirements. So I'm not going to read these verbatim, but this I think will help level set us to understand what exactly we are doing here today. So as a part of the IPLAN substantial compliance checklist for all of us who have to complete an IPLAN, we have to adhere to this checklist. And it does explicitly call out community participation and how community needs to be a part of this process. So you'll see that in the assessment, in the community health assessment process, community participation needs to be identified in your IPLAN through identifying the community health problems and setting the priorities. Community needs to be involved in how you describe the community participation process, who's been involved, and how you developed how you included them. In the community health improvement plan process of the part of the IPLAN, you need to talk about how community participation was included in the development of the community health plan. So how they helped develop the plan itself, develop the goals, strategies, objectives, how they were included in that process. And then each strategy needs to include an analysis of the community resources that will contribute to the strategies and objectives. FAB accreditation also does also include community participation. So if you are already FAB accredited and are going through re-accreditation, or you want to become a FAB accredited local health department, community participation is also required. So they specify actually a little bit more in detail what they're looking for. So community partners need to be involved in the community health assessment process through 2 non-governmental organizations, 2 community members that represent the populations that are most disproportionately affected by the conditions that you're assessing in your IPLAN. They need to be the elements and strategies of the community health improvement plan need to be in partnership with community and with others. And then they also note broad participation from stakeholders and partners and folks at the table to monitor your progress on your implementation of strategies. So throughout the whole IPLAN process, from the assessing phase through planning and implementation, community participation shows up multiple times. So it is important to be able to identify when you're creating your IPLAN, how you include the participation from the community. And I will pass it back to Lori to start us on talking about the spectrum of community engagement.
Thanks, Samantha. So, first, just level setting on the definition of community engagement. It really is the activities and the process of working collaboratively with and through community residents, groups, and organizations who are from, led by, and or who partner closely with the populations that we seek to benefit and who are most impacted by health inequities. So if you look at this definition and think about this, we're not talking about every single resident in the community, but we do need to prioritize those populations who we really are trying to impact because they have inequities, they're experiencing greater inequities, they're impacted by social and structural determinants of health, and those sorts of things. While there are initiatives that we implement that address everyone in the community, there are health problems and issues where there are disparities, where there are inequities, and those are areas that we're really trying to find out who those populations are that are being impacted and bring those folks into oh, are you not seeing my screen? Samantha?
I'm seeing your screen.
Okay. Someone sent me a note saying, are we supposed to be seeing screen? Okay. Um, so we are trying to reach those populations. And oftentimes there are organizations or groups who, because of the services they provide or the location, geographic location, or other things, they are able to access those groups, those populations even more so. So that's what we're thinking about in terms of community engagement here, both the individual residents themselves and groups and organizations who work closely with them, who can help engage them. So when we're thinking about engaging the community, we really want to understand and define who is the community, who are those priority populations that we want to be sure that are represented, that are included, that we're hearing from, that are guiding the work, guiding the priorities, those sorts of things. What is it that we want the community to do? Are we asking them for their opinions? Are we asking them for their perspectives? Are we hoping that they will share information out, that they will do something? So we really need to be very clear on what it is that we want from the community. And then are we willing to change or course correct or do something as a result of what the community is telling us? If we're not, then we need to rethink what we're expecting from the community because it can be very harmful to ask folks and then not use that information or that data. So that's an important consideration to think about. I want to share here, just as we're level setting and thinking about this, an excellent article for you to dig into, assessing meaningful community engagement, a conceptual model to advance health equity through transformed systems for health. Sorry. You can click on this link to see the article, and in this article, you will see the visual to the right here, which is the framework. It's intended to be a dynamic relationship um, between all of these components, these sort of petals, if you will, off of the core principles. And the core principles are also listed for having meaningful community engagement. So you'll see these core principles here to the left on the screen, that it's not a one-time thing, that it's intended to be ongoing, that building trust and relationships is absolutely essential in this process. We need to be transparent. We need to be clear. We need to do what we say we're going to do. If we say we're going to come back to them with information, if we say we're going to leverage or use their information, or they have decision making power, all of those things we have to hold uphold, and to build that trust. That we have shared governance, so it's not just our health department, our organization who is governing and leading, but we are also co-leading that with a community member is can be really helpful and is a strong principle of community engagement. Equitably financed, so when possible, we're paying people for their time, or there's some kind of benefit that they're getting for their participation, and that's very clear upfront. We're co-creating the agendas and the work and the meetings and the design and the way we make decisions, that it's also bi-directional. We're just not imparting information, or we're not just soliciting information from them, but it really is bi-directional in that relationship. And that we acknowledge that everyone can bring something to the table, and there are multiple levels of knowledge, and lived and living experience is equally as important, if not more so, than the experience that we gain from data and other sources. That it's culturally centered based on the population that we're working with, and inclusive. So those principles are further defined in this article, and I encourage you to take a look at that. And then the second tool that we're grounding the work in is this spectrum of community engagement. And you can click on the link here to see a full PDF on this spectrum that starts with ignoring, where people really aren't involved in the decision-making aspect. There's closed-door meetings. They're not at the level on the other end of the spectrum where they are really leading, community members are leading, and equity is achieved through community-driven decision-making. So all along the spectrum, from inform, consult, involve, collaborate, and deferring to the community, we run the gamut probably on different things that we do as our organizations. We may at times be more on the ignore end, not intentionally, but because of the function of the work. Maybe it's a regulatory piece or something, and that's the way it's set up or designed. Maybe it is something where we are have knowledge, and we're sharing that information from federal decision makers or whoever it may be, and our role is just to inform. So there's not a wrong place to be at certain times on the spectrum, but when we're talking about community engagement in the IPLAN process, we are trying to move along this spectrum where we really are collaborating and at times deferring to the community, so that they are helping to identify and solve the problems with the solutions they know will work, and they're helping to lead the implementation of those solutions. So we'll take a look at each of these on the spectrum just really quickly. In the ignore stage, they're not, community members don't have access to the decision-making process. In the informed stage, we are providing the community with information. It may be fact sheets or other promotional materials. In the consulting stage, we are gathering input from the community. It's when we do those focus groups, surveys, uh, town halls, other things like that, to gather information from them. Involve is where we are ensuring the needs and assets are woven throughout the process. We're doing community forums to check in and share where we're at and involve them in the next steps and planning the next steps and the next stages. So consult and involve may even work together. In collaborate, the community plays a leadership role. They are part of leading the initiatives. They're co-designing and co-implementing solutions. And in the defer to stage, equity is achieved through community-driven decision-making. We can use this spectrum for a variety of ways. One is to be able to really identify and acknowledge marginalization. So if we break down existing barriers to participation, we can eliminate that marginalization. Marginalization in some places does happen intentionally. It is by design. And in other places, it's completely overlooked. And it's not necessarily by design, but it is happening. And we want to be able to acknowledge and identify that so we can break down the barriers that are causing that marginalization. The spectrum can also be used to assert a clear vision. So, really, to help us keep us grounded in what the community wants and needs and hold us accountable to the community by practicing inclusion, by focusing on the things that the community is living and experiencing, including racial injustice and oppression. And it helps to foster that community ownership by including the community in the development of that vision. The spectrum can also help us to think about and articulate a developmental process that we're not always just going to be able to start on the very far right end of the spectrum with defer to. We've got to build capacity. We've got to help people understand why they should be involved and build the trust and the relationships and build that capacity so they have the skills, the information, the resources, the things that they need to fully participate. So at times that will mean breaking down systems and systems barriers so that they can participate. And then finally, the spectrum can be helpful in assessing our community participation efforts to see where we're at and if we're actually progressing and identify some goals for engagement so that we can continue improving across that spectrum of community engagement. So Samantha has put together another Zoom poll, and we'll take that now to see where you fall on the community engagement spectrum in the assessment phase of IPLAN, in the action planning phase of IPLAN, and in the implementation phase of IPLAN. So you're going to answer 3 different questions. You'll just scroll down when that poll comes up on your screen to answer each of them, and we'll see where you fall.
And
Go ahead, Samantha.
responses are anonymous, so feel free to be as candid as you would like to be, because this is a completely anonymous response.
You're real quiet there, Samantha, but I think what you said, you're anonymous in your responses. Yeah, so no worries there. %, 53% participated. Like to get up to 75 or 80. There we go. Thank you. Thanks for being honest, everybody, on this. I know it's difficult. We'd all love to be at defer to, or moving higher on that spectrum, but the reality is that, sometimes we are at different phases, especially when we have an unfunded mandate and we have to do this, right? And it takes more time, it takes longer, takes resources to engage the community, and we may not have that. So we've got 77 here, so let's end that, Samantha, and share those results. So it looks like 3% are ignore, 18% inform, and then we've got a pretty good range here, 24% consult, 26% involve, and 26%. So about a third in those 3 in the middle, consult, involve, and collaborate. And then we also have a person at defer to. So all across this spectrum for the assessment stage, when we are talking about the planning stage, it looks like we are similar here, a little bit higher in involve and collaborate, and we're not having anyone reporting in defer to, that they've turned planning over completely to the community. And for implementation, uh, let's see, definitely much higher on collaboration, which is great, and no one in defer to. Really interesting results. Thank you so much for sharing that. All right. So I would just want to highlight here the opportunities for engagement in iPlan. Samantha noted what the substantial compliance check requirements are and the FAB requirements. And I've listed a few things. And if you'll direct your eyes to the screen, I'm going to ask you what I'm missing, maybe missing some things here. In the assessment phase, oftentimes one of the very first tasks that folks do is they create a community health advisory committee to guide their work. This is similar to what hospitals do in their CH&A process. They might form subcommittees to help design and lead any of the assessments or data collection. You all might identify the priority populations, those impacted the greatest by some of the health inequities. You might develop your guiding questions with the community or purpose statement for the assessments. Community might be involved in helping to collect or conduct primary data collection, so surveys or focus groups. You might conduct town halls. So a lot of different opportunities to engage in the assessment process. In the planning process, you may have folks involved in the prioritization process. They may help identify the prioritization criteria. What's important to the community as you're narrowing and making decisions about what those IPLAN priorities will be. They may be part of action teams or helping to develop plans. They may share the plans with others, may take them back to their organizations to help align them with their organization. And in implementation, they may be part of a coalition that's implementing or leading an action team or a coalition that's implementing work in that area. Might be sharing data or reporting progress towards implementation. Hopefully you're doing some celebrating and celebrating success throughout that implementation period, and they're part of that. Sharing progress, sharing challenges and solutions to overcome those challenges, and just collaborating overall, so we can see what our collective impact is together. And they may be also involved in community organizing for advocacy, policy, and systems change work. So what are there any other opportunities in assessment, planning, or implementation for community engagement that we've missed here that we should add? You can raise a hand or put a note in the chat. Any other things that we are missing here? Opportunities for engagement in the IPLAN process? All right, well, hearing none, we will move on. If you think about something, go ahead and add it in the chat, and we will definitely add it to this document before we send the slides out. So now I'm going to turn it over to Karan to talk about tools and resources for moving along the community engagement spectrum.
Thank you, Lori. Hi, everyone. My name is Karen Aguirre. I'm the Senior Manager with Community Capacity Development. I'm fairly new, and I'm very excited to talk to you all about the tools and the resources for moving along that community engagement spectrum that Lori just spent the last 30 minutes talking about. So let's go on to the next slide, please. Great. So in the chat, our team would like you all to answer, how do you know if you have the right organizations and people involved in your effort? Let me give you all like 60 seconds, maybe 2 minutes to type in your answers. We're going to read them out loud and then move forward. Okay, I'm seeing some comments come in. People are naming active participation. You have folks at the table who are reaching a common end goal, having key stakeholders with the knowledge that's needed to address the problem. But what I am really seeing here as a common thread is having that common mission and everyone being aligned. So thank you. We'll go ahead and go on to the next slide. Perfect. So one thing that's really key for creating those community engagement plans is, to no surprise, relationship building. And what we're asking you to do is to make sure that you're thinking outside of the box about what groups you usually engage, and to scan for organizations that might be new, that may have not been involved in your work just yet, but that should be at the table with you. We also like to bring up to the top that it's really important to bring in those new partners, but also keep in mind that when you are inviting them over to your table, that it's just going to take some time to build trust and partnership. And then, of course, we like to remind folks that building credibility and being consistent is key to keeping your partners happy, but also creating that space where people want to join the mission as well. So if you take a quick peek at the 4 buckets that we have here, some of our tips include making sure that you're going broad and deep, making sure that no community is left in the dark, that you're really hitting each block, and also making sure that when you are communicating with them, that you're being real. And sometimes this can be hard to do, because when we work with communities, we are sometimes met with anger or distrust and mistrust. But what has worked over the years are teams that get together and are not afraid to be honest and transparent, who are okay with saying, no, we don't have that with us right now, but we are going to take your feedback and we're going to make sure that if we ever get the funds, you know, what you told us will be considered as like the next funding cycle. We want to make sure that you're showing up. Showing up is more than just being there in person. It's being an active listener. It's like going to the barbecue, enjoying the food, talking to new folks, and not just standing by the punch bowl and not speaking to anyone. And then lastly, as a reminder, just be graceful and patient. Trust doesn't grow overnight, and sometimes it takes even a few years to get to a place in a relationship where you feel like it's really working as a two-way street. So now we're going to go on to the next slide. And we are going to make sure that you all are split up into groups so that you can be a part of this reflection and breakout. We have 3 questions that we want you all to discuss with each other. And these 3 questions are actually questions that you yourselves can use with the communities that you're trying to get information from. The first one being, what's something that you love and appreciate about your hometown? It could be your block, it could be your neighborhood. You get to pick how much you want to zoom into this answer. The second one being, what's something that is limiting health-wise or with social determinants of health? So what's that active problem that you're seeing in your neighborhood or town? And then the third one, of course, allowing us a space to imagine what our future looks like if everything were to work out in our manner, which is, what does a thriving community look like if we were to have no resource limitations? So we're going to go ahead and split folks up. Samantha, I know you're going to help me do that.
I'm going to automatically open the rooms and you should be brought into a breakout group. If you are not, please let me know. I'll be in the main room so I can help anybody. So we are going to be in these breakout groups for a few 15 minutes to allow for everyone to have the opportunity to speak and answer these questions. Okay. Thank you all for that feedback. So as I noted, communication is really important for every phase of the of communication. It's really important for every phase of the IPLAN process. It's really important to get community input in your assessment phase. It's where it allows you to build relationships with your communities when you're not only including them in the assessment phase, but also in the action planning and implementation processes. There's, I think sometimes we get into the sticks and into the muds with really sticking with the folks that we already know. So a couple things to keep in mind as you're as you're doing communication and outreach in your work. One is to revisit who is engaged and how. So thinking about who is engaged, who can answer the questions that you're asking. Qualitative data is really important for being able to understand what is actually going on from the community, from the perspective of the community. You're hearing directly from the folks that are most directly impacted by the work that you're doing. So who can answer some of these questions that you're asking? Who do you want to hear from? Who do you not typically hear from? Who is missing from this? From your typical community engagement process with your assessments, who's missing from your action planning, who's missing from your implementation, who are you not hearing from that you think is really important to be able to provide their perspective throughout this whole process. Think a little bit more deeply about who works closely with these communities that you're wanting to work with. There are a lot of people in each of our communities that can be used or can be connected to as community liaisons or connectors, folks who may be working for a community-based organization or working for a faith-based group or a church or a another local department or a city council member or something like that who has connections to the community members that you're hoping to engage in this process. How do you reach out to them? How do you build trust and relationships with them to be able to do this work? And then thinking about this work across multiple internal teams. The folks who are working on the IPLAN process are not the only people who are working on the folks who are working on the IPLAN process are not the only people who are doing this work, who are reaching out to the community, who are connecting to them. They are the ones that you can reach out to other people in the internal process to continue to do this work. I'm sorry, I'm rambling. Also, it's important to recognize that when you're partnering with community organizations, think about these priority populations that you would like to conduct assessment activities with. Who are folks that you don't typically hear from? And that can include people of color, the LGBTQIA+ community, veterans, refugees, immigrants, and migrants. These folks, people with disabilities and their caretakers, maybe folks that you don't hear from as often, that would provide a very unique perspective. So how can you connect to the people who are already connected to them? How can you work with your internal teams who are also doing community work that you might not be engaging with to bring them into the fold? And so that's really important when you're considering communication and outreach in your work. Recruiting community participants through these known avenues really helps when you're doing this work, and making sure that you're tailoring your communication strategies to what you're really hoping to get out of. So I'm going to be sharing in a moment a method of communication that is helpful that we've used before, that a lot of other folks use. It's not the only method. Oh, I went too far. It is not the only method for community for communications out to the public and to the community, but is one that is can be used, and I will share the link in the chat in a moment. But this is from the community toolbox. So really when we're thinking about who we're going to reach out to, what we're going to do, we oftentimes, I think it's really important to create a communication plan. And this can be a formalized plan, this can be follow these exact steps. This could be something that is more ad hoc or intuitive to the work that you're doing, but it's really important to think about tailoring the messages and tailoring what you want to communicate to get back for your IPLAN process. So that includes whether you're looking for folks to be a part of the input or a part of the action planning or implementation phases. So thinking about first, why do you want to communicate with your community? What's your purpose? Needing to know who you want to communicate, who's your specific audience, what groups are these priority populations that you might not be hearing from very often, or is it an existing group or coalition or mutual aid group or something that you'd like to be in contact with and build a relationship with to be able to have them a part of your IPLAN process? What current channels do you use? We were showing that graphic as folks were filling it out about what channels that they use. If you're somebody who exclusively uses social media, could you be attending finding community events and things that already exist in your community, whether it's a farmer's market or a association meeting or a Rotary Club meeting or whatever that is, to go out and speak with your community? So what channels do you currently use and what channels could you be using more frequently that you might not be using as often? And how will you distribute your message? Will you use trusted communicators from your community, those trusted community liaisons, to be able to distribute your message? So there are different ways that you can create a communication plan, but it's incredibly important as you're going through this process to consistently be thinking about how you're doing outreach with your community. Okay. And so, as I said, getting community engagement is a massive, and doing outreach with your community is massively important in the assessment phases. So, qualitative data and quantitative data are both incredibly important to the IPLAN process. That, you know, when you are drafting your IPLAN to be able to submit it to IDPH for your substantial compliance, it's important to share how you collected the data, what data you collected, and what methods you used to collect that data. And quantitative data is often collected through iQuery or other data sources and can tell you a picture of what is going on in your community, but quantitative data alone is not sufficient to be able to really understand the full picture of your community's health. Quantitative data does not tell you the full story. It can often omit structural inequities. It doesn't tell you the full picture of what community members are facing on a day-to-day basis that impacts maybe health problems that you're seeing are the biggest in the community. And oftentimes health disparities can be misinterpreted when we're just looking at quantitative data. Qualitative data tells us the why and the how. You're hearing a lot more about the social and structural determinants of health that impact these health problems that you're seeing are the biggest issues in your community through quantitative data, and how the communities experience these social determinants. So social determinants like housing or transportation, and that was a little bit about what my small group talked about earlier. Having no access to transportation then doesn't allow them to be able to go to their doctor's appointments or get access to healthy foods, things like that. Primary data is super important because it really gets the perspective of what are the biggest concerns of your community members. And when you're describing in your IPLAN what the health problems are, those are the health problems that are the biggest concern of your community. And then finally, it also describes any policies that you may need to address or barriers to health that you could be utilizing when you're doing your action planning. So guiding questions are a really great way for the folks who are going through the IPLAN process to inform the assessment activities. These guiding questions, it's important to note that guiding questions are things that help inform the work. They're not things that are they're not questions that you're going to be putting in a community survey necessarily or getting from community focus groups. Guiding questions help you determine what questions you want to ask in your assessment phase. So they're typically selected by the IPLAN process in the community to help inform what do we want to be answered, what was the secondary data not telling us, and what do we want to know more about. It helps us identify these bigger picture issues and these themes and define the purpose of your community assessment data. So like a research project or an evaluation, we're determining what we want from the assessment. What questions do we need to answer in the assessment to be able to figure out what are the biggest problems of our community. Our guiding questions really provide guidance on what we want to learn from the community. Some examples of that, this is a sample of guiding questions that we got from MAP 2.0. These are not necessarily all of them and are not required, but it really gives you a picture to be able to understand what you want to learn from the assessment. So it could be something as, what does health equity look like in your community? So how can you frame questions in a survey or questions in a focus group around what health equity looks like in your community? They could be questions of how are the various types of stakeholders impacting health inequities in the community or contributing. So what kind of questions can you ask to really get to a better understanding from your community members of what types of stakeholders are impacting inequities in the community or contributing to the health and wellness of them. So these are not questions that you specifically ask. As a reminder, we think it's really important to restate that. These are questions that you will guide what you do ask. It gives you a purpose and a level setting. And finally, I think, and I know I've been talking for a long time, and this is like a lecture part of this training, so bear with me here, but a lot of folks, as we know, most of the data collection that they're doing for qualitative data for community input are surveys and focus groups. So through our professional experience at IPHI and a lot of the work that we've done previously with MAP, we created an introductory list of some do's and don'ts, some things that are typically done and ways that can be improved for future primary data collection sources. We want to note that this list is not comprehensive. This is just common challenges that we've seen, that we ourselves have experienced, that may be helpful as you approach your data collection. So some do's when it comes to paper surveys and things like that, ensuring that your surveys are made available online and by paper is really helpful. Some folks are more tech savvy and you can hand somebody a QR code, or you can send an email out to a community organization and they can use a link and be able to fill out that survey. But sometimes paper surveys are really helpful if you're attending a community event, which is something that allows you to get a lot more input from people that you may not be typically getting input from. And having a paper survey physically handy to be able to answer multiple choice questions or Likert questions will allow you to get a lot more responses for folks who you might be missing because they don't have access to technology or don't have the ability to use technology in the way that they would need to using an online survey. Being as inclusive as possible is also a part of that with paper surveys, and not only with paper surveys, but offering participation in other languages, whether that's a focus group. If you know that you have a large population that speaks Spanish, being able to offer a focus group or a survey in another language. Piloting and testing your surveys and listening sessions is really important to be able to say, these are the list of questions that we've come up with. Is the results of these questions really what we wanted to hear? Are we getting the answers that we wanted out of the survey? And so piloting that and knowing that ahead of time, so when you do start getting the actual input from community, you know this is the answers that you wanted. prioritizing populations based on the experiences of experiencing the greatest inequities. And a part of that is a lot of these folks, it's really helpful if possible, because I know a lot of this is a barrier for folks being able to pay for that time and expertise. Whether that's a $5 gift card for filling out a survey, or a $20 gift card for participating in a focus group, whatever that looks like, it incentivizes folks to be able to participate. Make sure that you're asking open-ended questions in listening sessions, and starting with easier questions in both your survey and your listening sessions to really sequence out and build up the questions to get what you need to get. When you're trying to build relationships and focusing on relationship building that trust by following up regularly, offering that participation in other ways other than community input, arriving early and greeting folks if you're in person, and following up with findings and how the data was used and how they can continue to be involved in the process is really important for building that trust. So for your next cycle, or as you continue through implementation, you have that great input and feedback and participation from the actual community members. Some don'ts that we've recognized as challenges that we've experienced and are common challenges across for folks who are completing IPLANs is reaching out to the same people every year. Oftentimes, when we're doing primary data collection, we do the least barrier issues, so the folks that we hear from year and year again. Making long and detailed surveys. Survey fatigue is real, and folks are not going to fill out a survey with over 100 questions on it, whether it's on paper or online. And ensuring that there are too many open-ended questions in a survey. Having Likert scale questions is a really great way to get across what you need to get across without burdening the folks who are filling out the survey with having to fill out a paragraph long answer. And only, like I said earlier, only contacting people in the assessment phase. Folks who are participating in this want to be involved, want to understand what's going on in their community, and the plans that are being developed are going to, how they're going to affect them on a daily basis. And finally, using jargons, acronyms, things like that. Community members aren't always understanding of the jargon that is being used in health departments and the acronyms that are being used. So ensuring that as you're going through this process, you're making sure that it's level set for everyone around you, that everyone can understand what you're asking of them.
I'm gonna hop in real quick to share a question from the audience from April. She is asking, how long do you suggest having surveys available? So either you or Lori can help answer that question.
Yeah, that is a really great question. And I think it's something to add to this do's and don'ts as well. Oh, Lori, I see you on mute.
Oh, I'm happy to have you answer. I just wanted to say that it really depends on what your data collection plan is. So for example, our organization leads the Alliance for Health Equity, and they just did a massive data collection process for the community health needs assessment with hospitals in Chicago and Cook County. And they had a very, very detailed plan for conducting that in terms of zip codes that they needed to collect data in and neighborhoods, as well as priority population groups. And so the numbers of how many surveys they got weren't nearly as important as ensuring that those numbers represented the types of community members they needed to hear from. And so they planned on extra time to do additional outreach in those communities to get that. So it's kind of a challenging answer to, or question to say how long should it be open. It really needs to be open as long as you can to get the data from the groups you need. You should have a targeted plan to capture that. But if we were doing just a regular survey where we weren't having to do all that extra outreach, we'd leave it open a minimum of 2 weeks and sometimes longer. If people see that there's a deadline far off, they are going to procrastinate and put off taking the survey. So the more that you can create an urgency in having them actually do it by a deadline that's tighter, so you may have a different deadline for different groups of people. think about it like that. But you also want to be respectful of people and give them time to plan in their calendar. So telling them how long to carve out, 10, 15 minutes or whatever it is, but pilot test that and figure out how long it takes to take it, and um and then let people know that, and with a deadline. But I really encourage trying to leave it open for at least 2 weeks. But in this particular case, we were collecting survey data over a 2-month period because of this extensive outreach.
Thank you, Lori. Yeah, that's exactly what I was gonna say. No, there's no perfect answer or perfect formula to be able to figure out exactly how long you keep something open or how long you conduct. But it's important to recognize that there are going to be obstacles and barriers to be able to get comprehensive community input. And so marking that time, that buffer time into your planning before you send out a survey or before you start conducting interviews or focus groups or any other data collection methods is really important, and making sure that you're paying attention not only to the number, but who is a part of who has filled out the survey, to be able to feel like you're getting comprehensive feedback. So thank you for that question. Is there anything else on this list that folks who have conducted primary data collection can think of? Any additional questions or anything else on this list of do's and don'ts that you have learned yourself that you'd like to add and share with other local health departments here now? Okay, and if you think of some more as we're continuing on this journey, feel free to drop those in the chat as well. Wonderful. Okay, so the next part of this training, we're hoping to talk a little bit more about sustainable community engagement through implementation. This is the point where we'll get some really great feedback and a really great peer presentation from Amanda Mell from Boone County Health Department. She was able to provide us with a video to be able to share today, peer presentation in lieu of being able to join today's training. But before we go into that, I wanted to talk a little bit about what she'll be talking about today. So the first thing here is community engagement through prioritization. So it's really important to think about how the community is currently involved in the process for developing and identifying priorities and developing the community action plan, and that's a part of the substantial compliance checklist to say how you included community participation in identifying the priorities and developing the plan, and what are the current barriers. So first, sharing findings is really important, and I think this has been a through line of this training to say, if you want to build relationships and build trust with your community members, it's important to continually keep them updated and follow up regularly, and where you are at in the IPLAN process. If you are finished with assessing and you've collected all of your data and you're analyzing all that data and summarizing that data, it's really important to share those findings out. Not only does it build trust with the community to say, this is how we use the information that you shared with us, it also helps them be a part of the process when identifying those priorities, because you want to know what's the biggest concerns of your community. So inviting existing partners and including those communities who participated to share that data out, whether it's a presentation or an event that you organize to share those findings, ensuring that you're making those events accessible, and that can be physically accessible through visually appealing summaries, and that could be an infographic to share on your social media, or flyers that you can send out, or printed materials if you're having these in person, or a link that you can share that's virtual. Make it something that is easy to understand. If you are sharing this out with your findings out with the community, it needs to be in a way that's not jargony and not filled with acronyms, so it's understandable for a wide range of people who would like to hear this information. And then of course there's physical accessibility as well. If you're having this event in person? How is the event in the venue ADA accessible? Are you allowing for folks who maybe not be able to make it in person and making it a hybrid situation? Things like that to keep in mind when you're sharing the findings. And then prioritizing the issues. So making sure you're engaging the community to develop the priorities. Utilize a priority process that requires so many people at the table to make sure that you're hearing from a wide range of people and diverse perspectives. And then keep in mind experts. Experts are people who are professionals who work in this field, who are part of the whole jelly bean diagram of the public health system. But experts are also people with lived experience, people who are the most affected by the work that will be done, people who have lived these health problems and these community problems on a day-to-day basis, and who could help support and lead the work through priority planning and goal development and implementation and be a part of an action team. So things to consider when you're sharing the findings and then developing the priorities. There are multiple prioritization processes that can be used, and they can be used differently for different things or different barriers or obstacles that you face, or different essentially the prioritization processes are helped define what process you use by community members and by the folks that are at the table when you are developing the priorities and doing the action planning work. So you should work together to understand which prioritization process we'll use for you, and need to be able to describe how the prioritization process is used in your IPLAN. So that's a part of your IPLAN substantial compliance, is to be able to describe what process you used and why you picked that process. So these are multiple different common prioritization processes that can be used that are typically used for different things, like multi-voting techniques for when you have a long list of health problems that need to be narrowed down, or a prioritization matrix when you have a long list of criteria, or when you're restricted to focusing on one or a few health issues, things like that to be considered. And this is pulled from a really great nature resource that I'll share in the chat as well with folks. And I'll also be following up with links to these things that I'm sharing that can go a little bit more into deep. But it's things to consider when you're developing a priority process. It should be developed, which process you're using should be developed by you and your community. And now I will stop speaking, you'll stop hearing from me, and we will be sharing the peer presentation from Amanda Mel. We're really excited to share this, and let me hope this works.
Okay. Good afternoon. Amanda Mel here, Public Health Administrator with the Boone County Health Department. Sorry I couldn't be at the meeting in person today with y'all. I'm in Washington, D.C. as part of the SHO-NACHO annual meeting and lobbying activities for Hill Day. So excited to be there, but I'm happy to be recording this informational session and honored to have been asked by Illinois Public Health Institute to provide a little bit of information on where the rubber has met the road here at the Boone County Health Department for our IPLAN action plan development and implementation, and even more specifically, how we have been able to engage our community and keep them engaged. So I'm talking about people with lived experience, I'm talking about community partners, I'm talking about leaders in the community, I'm talking about staff members who are championing our IPLAN and its action cycle, and I'll share a little bit more about that in my brief presentation. So with our community groups, we have 3 health priorities and we have 4 community groups. So our behavioral health priority has the Behavioral Health Task Force and the Youth Drug Prevention Coalition. And those 2 groups meet on a monthly or an every other month cycle. Some of them have subcommittees, etc. Our maternal child health priority is linked to our Maternal Child Health Council, and our food security priority is linked to our Boone County County Hunger Coalition. And each one of these groups are involved in meeting regularly. It has taken our department years to build these groups. Some of these groups were in place before the most recent IPLAN. Some of these groups have developed even further during our most recent IPLAN. And our Hunger Coalition in particular was developed 8 years ago, went through a 2-year period of really just being very static. And then we spent about 18 months really re-energizing it. So we've been through the gamut of dealing with keeping the groups going. And one of the things that we find really helpful is making sure that we have bylaws and a strategic plan and a structure for each one of those groups that is independent to the group, but is crosswalked into the IPLAN document and the IPLAN action plan, which I'll talk about in just a little bit. A couple key activities that are important is consistent outreach and recruitment. I'll share some key forms that we use to outreach to partners and recruit new people to join. Most recently, in the last couple of years, we've been really focused on determining if we have enough folks that sit around those community stakeholder group tables that have lived experience in the areas and the issues that we're dealing with within these health priorities. So have we recruited mothers and parents and grandparents and people who have been on the WIC program and people who have utilized the SNAP benefits on our Hunger Coalition, right? Have we recruited enough folks that are in recovery or are, of adolescent age for our Youth Drug Prevention Coalition, right? Do we have enough minority community members and members that fit the demographics of the community that we're serving? And I'll talk about that in a little bit. It's a constant process to keep our partners engaged. My staff that champion these activities are regularly setting up coffee dates, picking up the phone and calling partners, sending emails and checking in if we haven't heard from somebody in 2 or 3 months, double checking if there's been staff turnover, who's the new contact. And it's extremely time consuming. It's a huge piece of the maintenance of the metronome and keeping things pushing forward. And then we've had internal turnover at our health department, and some of the people that have championed our IPLAN and these community groups have come and gone. And so we've had to rehire or temporarily assign somebody to be the champion or have co-leads for a while to keep the initiatives going. So that's been really important. We have community partners that sit in key roles on these community groups, treasurer, secretary, co-chair, head of a subcommittee. And that's another good way to keep partners engaged and involved if they're holding a leadership role within that group, that coalition, or that committee. Helps them to be engaged and also helps them to recruit others, perhaps within their organization or a neighboring organization in the community that maybe the health department hasn't worked with most directly, but has heard about, but this particular partner has a better, stronger connection with them. So that's a little bit about our key community groups, absolutely essential to the work that we do. Our action planning. So as I mentioned before, each one of our community partner groups has a strategic plan of their own that's linked to their more granular work. And those more granular activities are crosswalked up into the larger IPLAN. So our community meetings have a standing agenda item at most meetings for their specific strategic plan, action plan activities, and then specifically IPLAN related action plan activities. So every single month or every single quarter or every single however often that group is meeting, there's 5, 10, 15 minutes set aside in every meeting to pull up that action plan, revisit certain granular activities, keep everybody engaged, remind them what we're working on. And we have found that to be essential to keeping that metronome moving at the tempo that we need to keep it moving at, teaching people about how IPLAN works and how it's a several-year, multi-year process. Something we've implemented just in 2025, we're on our second month of it, is we've gotten some grants specifically related to several of our health priorities, and we have tracking tool 3 minutes, and then the general meeting follows. We allow partners the flexibility to come to just the action planning session at the beginning and then leave if they need to, or if they can't be part of those action planning activities, they can just come to the general meeting. But we're finding that people are engaged enough that they mostly want to stay for the entire marathon, and we allow that to happen with a lot of great success. And so we have to be prepared to be ready for those awkward transitions, always keeping that metronome moving, always keeping ourselves on tempo and on track. Back to the daily activities, back to the weekly activities, back to the monthly activities, back to the quarterly activities, back to the biannual activities, back to the yearly IPLAN report outs, and keeping everything in focus and on track is so key to this for us. So this slide, being okay with awkward silence, I'm just going to start with that because it makes me smile every time. So one of the things that I've spent a lot of time teaching my staff that lead these meetings is when we're engaging partners and we're throwing out an activity that we want them to take on. We want them to take on this homework assignment or, report back at the next meeting, and you sit around the table and it's awkward and nobody wants to step up, nobody wants to sign up. I've taught staff to sit there in silence and be okay with that until, somebody says, I'm going to give that a shot. I'll try it. Sounds great, YMCA. Do you want to have a Zoom offline? Can we help you? Can we help you launch it so it feels more comfortable? So just really encouraging partners to step up and making sure we're not always the ones at the end of the day taking on all the projects, because then you don't have enough bandwidth to do it. You'll burn your people out. You'll burn yourself out. And then the plans and the groups and the activities fall by the wayside and the metronome gets off tempo, right? Constant emailing, constant time on the phone. My younger staff don't like to spend as much time on the phone as maybe some of my older, more seasoned staff do, but teaching all staff to get on the phone, that personalized touch is important. Coffee dates, check-ins, take the police department donuts, meet with them because we're working on something with behavioral health for the justice system, making sure that personal touch happens. We write thank you letters once a year at Christmas time during the holidays to thank our partners, and staff handwrite those out. Little things like that can be really helpful with engagement. Something else that's important is what's in it for the partners around the table. So we oftentimes have a standing agenda, checking in with partners. How are these meetings going for you? What would you like to see differently? And when we're writing a community level grant that maybe is facilitated through the health department as the chief health strategist, we're still checking in with them. If the YMCA has an idea or the police department has an idea or a faith-based organization has an idea and they want to write something in that is very applicable to the work that's being done within that health priority, and we can create a subcontractor or an MOU, write them in, and they're going to carry out some of the work, that's a really great way to get stakeholder buy-in. We're constantly talking about ways in which the partners can utilize the strategic plans that are specifically tied to each one of these community groups, but also the bigger IPLAN. How can you use that when you're doing your annual report out to your organization's board? How can you use that and the data in there for your grant applications for your respective organization? How can you use the data that are available on our dashboards that are now linked to our IPLAN, that are now linked to these community groups, to give a board presentation, to create a PowerPoint, to do a community listening session, to refine your parent newsletter at the school district? We try to give those examples of how the things that are being created in these meetings are most useful to their own organizations, and that really helps with buy-in as well. So some of our key forms, I'm going to show you really briefly before I conclude, a recruitment form and survey tool that we use to recruit people to our community groups. I'm going to pull up a couple of our strategic planning tracking tools. I'm going to share our biannual IPLAN tracking worksheets that we have just created, and we actually just put our first set of them together at the end of January. So this is hot off the press. We still don't totally know what we're doing, but so far so good. And that links to our IPLAN tracking tool. Several of those spreadsheets are blank because we just finished the worksheets in the community groups, and now my strategist and program staff will transfer that information over to those larger spreadsheets, right? I don't have an example of this yet, but I will share with you that we are creating a lived experience survey. We're piloting this with the Maternal Child Health Council. This is a survey where we can anonymously get feedback on demographics and lived experience from the partners sitting around the table, so we can have a better idea if we are doing a good job of capturing people and experiences around the table that fit with the needs of our target populations. So we're really excited about that activity. Brand new. It's written in as a grant deliverable for one of our maternal child health grants for the year 2025. So we're pretty excited about that. Y'all can contact me offline if you have other questions. And I'm just going to spend a couple of seconds here pulling up some of these tools and showing y'all how we have them structured. Okay, so here's an example of one of our recruitment flyers, and you can see the logos of our different groups. There's a QR code, so if I go to a meeting out in the community, I might have some of these in my bag and get to talking to somebody about, oh yeah, what's the health department working on these days? Oh, I might be interested in joining a group, right? Or my staff might have copies of these up front. And when they click on the QR code, and we have it in English and Spanish, right? So that we can, if we have a language barrier, we can make sure to eliminate that if we're going to have Spanish speaking only folks joining our groups. They fill out the QR code, or they click the QR code, and then it just asks basic information. So rather than me writing down on a sticky note, it gets lost in my purse that, you know, John Doe or Juana Ramirez want to join one of these groups. It's a fillable form that comes through on the back end, and it goes to one of the strategists in my office's email account. And then we're able to follow up on the back end, and we have some basic information about who they are, if they belong to an organization, if they're a community member at large, what group they might be interested in, what they're most interested in being involved in. And it's better for a conversation starter. It makes it less awkward for my staff when they're calling people back. And I think that's it. Thank you so much for this opportunity to share our complex system that we've created here. We're pretty proud of it. We feel like it's working well, and it's a lot of work all the time, and we just have to stick with it. So happy to talk offline to anybody. Hope you have a great rest of your training, and thank you all for this opportunity and for your time. Good afternoon.
Samantha, we're wrapping up now, so bear with us in the last couple minutes. Just some key points that I just want to emphasize, that relationship building was just, you know, really present throughout everything Amanda said, and Karen and Samantha as well. And, you know, those phone calls, those coffee meetings, the one-on-ones, all of those types of things are important. And another piece that really was emphasized was, you know, someone serving in that health strategist role and thinking about the opportunities you have in front of groups or with groups where you can make these connections. So if anyone has any questions on any of the content we've covered so far, please feel free to put your questions in the chat. If we can't get to them today, we will come back to those and send you a follow-up email to all who were on today. And then finally, on our last slide here, we just want to thank you all for your participation. Samantha has put a link in the chat for an evaluation if you'll give us your feedback. It's really important that we have your feedback on the training, how we can make it better, do better. We're going to send you out some tools. There are a variety of resources at the end of these slides that you will receive for other tools and resources that you can click on and use. Some questions you can use in a discussion back with your team to help walk people through the spectrum of community engagement. And we have another training coming up on March 27th, turning data into information. And then a group TA session will be on April 24th, and we'll let you know what data sets will be provided at a later time. So please let us know if you have questions or comments. Thank you so much to Amanda and Karen and Samantha for your help here. We appreciate the support from IDPH and the Community Health Assessment and Planning Grant for sponsoring this training. And thank you all for your participation today. We appreciate you.